Tips: how to prevent and manage TB correct. Tuberculosis, TB, will no longer common for many people, because TB is a contagious disease, which causes health problems in the world second largest after HIV. Then how to prevent and deal with TB disease. Ari Widodo, health experts who had served as Deputy Medical Director at International SOS Indonesia, explained, TB is a serious problem because it is very easy transmission. Indonesia is among the top 5 countries with the highest number of TB patients in Southeast Asia, with the number of people with 305,000 inhabitants. Tuberculosis is a disease caused by acute or chronic infection caused by the bacterium Mycobacterium tuberculosis. Tuberculosis causes a strange reaction in the tissue of the lungs, which covers an area infected by the invasion of macrophages and the formation of a wall around the lesion by fibrous tissue that can form tubercles. This wall formation process helps limit the spread of tuberculosis bacteria in the lungs. TB disease usually strikes people who have immune people and the frail elderly who have a history of TB. But there are some groups of people who have a higher risk of developing tuberculosis, namely HIV, diabetes, and those who are undergoing chemotherapy, malnourished, drug addicts, smokers, and paramedics, often associated with TB patients. Patients with this disease usually have fever but not too high that lasts a long time, which is usually felt at night. Influenza-like fever will come and go. Other symptoms of tuberculosis patients displayed as well as appetite and weight loss, cough for more than 3 days, feeling unwell and weak. In addition to these symptoms, there are additional symptoms that are often encountered, among others, 1. Patients experiencing shortness of breath and pain in the chest. 2. Patients will be sweating at night but without any obvious cause. 3. Weight loss can also occur due to loss of appetite. 4. When patients cough or sputum, usually accompanied by blood. 5. Patients fever or chills for over a month. 6. The urine becomes red or murky. But these symptoms usually occur in more severe conditions. According to Ari, there are several ways that can be used to prevent tuberculosis, among others. 1. Always pay attention to the cleanliness of the house. 2. BCG is 1 when the baby is 2 months old. 3. When you find signs of TB, immediately go to the clinic. 4. Reduce contact with a person with active TB disease. 5. Maintain a good standard of living, with nutritious food, a healthy environment, and sport. However, if it has been diagnosed with tuberculosis, then that can be done to deal with, among other things. 1. Undergoing treatment of TB for several weeks without traveling anywhere. 2. Do not sleep in the same room with another person, even if a family member. This is done to prevent transmission of tuberculosis. 3. Do not spit in any place. 4. Using a mask. 5. Avoid cold air. 6. Do not make a habit of sharing personal items with others. 7. Eat food containing carbohydrates and protein. Ari warned, if you feel these symptoms, immediately do the examination to the doctor, because sooner addressed, the TB cure rate is also higher.